Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Trish Celano, who is the Assistant Chief Nursing Executive and Associate Chief Clinical Officer for AdventHealth, about the impact of turnover on the nursing workforce and AdventHealth's clinical ladder program. So, hi, Trish, how are you?
Hi, nice to see you.
Nice to see you too. Thanks for taking the time. And this is a big topic as we round the corner into 2026. Turnover is a never-ending issue in healthcare. So I wanted to kick off by asking you, what are the short-term and long-term impacts of high nurse turnover rates on a health system?
Sure, short and long are pretty similar, just the degree to which they compound.
Hmm.
Nursing turnover just leads us to shortages of nursing, to increased stress, increased team member burnout, workforce
Hmm.
burnout. At the end of the day, it impacts patient experience as well as clinical outcomes. Those are the further down the road. The
Hmm.
preliminary and really the short-term ones being two nurses themselves. Burnout being a significant one.
Hmm. Absolutely. And we're going to get into the clinical ladder program today. But before the introduction of the program, if you're able to share, what was the turnover rate?
Sure. Before we launched in 2021, we were 31.5%
Wow.
nursing
Okay.
turnover. Yep. Yep.
Yeah. And how much were you spending on recruiting and hiring for vacancies?
Oh my goodness, we were spending a lot. I don't think I could give
Yeah.
you a total number, but it was significant. As you
Hmm.
could imagine, if you're turning
Hmm.
over a third of your RNs every year, it's roughly 60,000 is an industry number
Hmm.
to onboard a new RN. So if you do the math, we have 25,000 nurses. Just 5,000 nurses at $60,000 is significant.
Yes.
Significant.
Yeah.
Uh, and that's just financial implications. Financial is just touching the surface. Really, the impact to care
Hmm.
delivery. That's where we really see some opportunities when you talk about nursing turnover.
Hmm. Absolutely. So walk me through the professional excellence program, the clinical ladder program. How did you
Sure.
begin that, and how does it benefit your nurses?
Sure, happy to. So, we actually we have 57 hospitals now, and we had about six hospitals that had a clinical ladder. Typically,
Hmm.
clinical ladders were in the purview of magnet organizations, magnet hospitals, and we had a number of them. We have eight now. I was the CNO of one of our magnet hospitals. M- the clinical ladders actually help create a structure for nurses to continue to advance, and we were
Hmm.
hearing from our bedside nurses quite loudly that it seemed to them that nurses, in order to advance in the organization, needed to get away from the bedside. Not something that you want to hear as a chief nursing officer. That
Hmm.
nurses feel like the only way to move ahead in their profession is to get away from the bedside care. So, as we did some investigation and research and thought about our own staff, the feedback that we got from our own staff, as well as looking at high performing magnet organizations, it was clear that we needed a tool, vehicle, program to help
Hmm.
create that across the entire organization. That's the clinical ladder. A program that allows our direct care frontline nurses to be able to be recognized for what they bring to the
Hmm.
bedside, their expertise, their experience. Um, it is to have a nurse that has 10 years experience is like having a block of gold. It,
Hmm.
it, it takes 10 years to get them to that point. So when those nurses leave the bedside for other roles, simply because they don't feel like they're valued and they don't feel like all of their experience and knowledge and what they bring is being appreciated or recognized. More importantly, we knew that there was something that we needed to jump on and address.
Hmm. Absolutely. And so you mentioned it a little bit, but why a clinical ladder program as your retention strategy, and what impact has it had on your organization's culture?
Sure. We chose the clinical ladder because it really affirms bedside nurses. That was
Hmm.
the issue that we were dealing with, and many other health systems across the United States. Nurses experiencing burnout and not feeling recognized. So we chose it because we really felt, after much research and deliberation with our frontline nurses, we have many nursing practice councils, which are
Hmm.
frontline nurse led. And our practice councils were telling us that, they, um, that a nursing professional ladder was what they wanted and what they felt like would give them the recognition as well as the ability to continue to advance without
Hmm.
having to leave the bedside. We didn't, just think up at the corporate office, this is the answer. And actually, the answer came from the front line, which is always the best way to get to that.
Hmm.
Your frontline staff and nurses know what they need, know what they want, know what's best for patients. When we ask them to solve our problems, they get solved more quickly and they are generally much more accurate.
Hmm. Absolutely. And what's been the nurse reaction to the program so far?
It's phenomenal. Really,
Good.
we couldn't have hoped for a better reaction. Now we built it with them. It was,
Hmm.
co-coordinated with our frontline team, co-developed, I should say, with the frontline team. But they have fully jumped in and engaged with it. They are helped to identify what the different levels should be,
Hmm.
what they should get recognized for, how nurses move through the model, what recognition would look like, and something which was kind of a first for clinical ladders across the U.S. We were the first ones to actually have an element of self care. Now,
Mm.
coming out of the pandemic, not no brainer, right? That nurses
Hmm.
are struggling with self care, but they were struggling with self care before the pandemic. It just was
Mm.
accelerated
Mm.
significantly. So, we have in our ladder an opportunity for nurses to focus on their own self care because at the end of the day, if they don't feel whole, how are they going to provide whole person care to our patients? And for us
Mhm.
at AdventHealth, that's really our signature focus is to provide whole person care. And we realized we were not helping our own bedside staff to do that.
Mhm.
Um, so we needed to address it. And
Absolutely.
they have just jumped on board. Our nurses who are on our clinical ladder, their retention is significantly improved. Significantly,
Wow.
it's the
Mhm.
lowest retention, the lowest turnover that we have in the company right now.
Mhm. Yeah, that was gonna be my next question for you. What's the new turnover rate after the program? I'm
So we
assuming
are
it's been
right now,
successful.
yeah, yep, happy to share these numbers.
Mhm.
Total turnover for RNs is at 14.8%. Now
Wow.
that's, that's all RNs, but when we look at the RNs who are able to participate in the ladder, right now our ladder is for full and part-time. It's not for per diem. We're
Mhm.
sorting out what the step might be for per diem nurses,
Mhm.
potentially, but we first wanted to address the request from the full and part-time. So our full and part-time nursing turnover is at 12.4, which is
Wow.
pretty phenomenal. Nurses who are on the ladder. So if you're on the ladder and you're full and part time, you're at less than 6%.
Wow.
So our
Wow, that's
goal is just
incredible.
to drive that number. Yeah, yeah,
Yeah, that's amazing. I mean, that's more than halfway, cutting
yeah. Well,
that
from
original
31, when you
31.
started
Yeah.
31 whole house, and now whole
Mhm.
house is 14.8, and
Yeah,
full and part time down to 6. We couldn't be more pleased, really. And
absolutely.
if anything, we're just saying, why didn't we take this company wide, sooner? But
Mhm.
everything in due time, right?
Absolutely. Yeah, and I know we mentioned the cost of, replacing one RN, but have there been any cost savings because of this program? I imagine yes.
Oh yeah, significant. I mean,
Yeah. Hmm.
if you if we've hired 3,000 less nurses in the last 3 years because of the
Hmm.
turnover improvement, right? So
Hmm.
if it's $60,000 per RN, in 1 year that's $60 million. One
Hmm.
year just for the training. That's not the replacement cost of that RN with agency, even if it's 50% agency or if it's 50% full-time hire. Those numbers vary depending what you're bringing on, but we haven't had to bring on any of it. We have
Hmm.
less than half of 1% of our nurses are agency now, which
Wow.
for is hundreds of millions of dollars of savings for the organization. Now, financial savings, that's just the tip of the iceberg. That's really
Hmm.
not what actually drives us. What drives us is the engagement of our frontline team members. That
Hmm.
they are they've just affirmed the clinical ladder, and they are continuing their engagement of bedside nursing has continues to increase. We're
Mhm.
almost at 80% engagement for RNs, which is also, you know, industry leading.
Mhm. Absolutely, and nurses are the backbone of healthcare, and it's what keeps patients coming back is that positive patient experience. So anything to keep better nurses at the
I would
bedside
agree. I
is
would
a
agree with you.
positive. Yeah.
That's right. That's right.
Absolutely. Yeah.
I think the key, is when they ask, when they say something, like we need to listen.
Mhm.
So many
Yeah.
times we think that, some those of us in the executive office might know actually what they really want or actually what they really mean, and
Mhm.
that's not the case. When nurses say this is a problem, whether it's development or burnout
Mhm.
or a number of different things, if you don't listen, that is bad for the organization, and which at the end
Mhm.
of the day is bad for our patients, bad for our
Absolutely.
communities. Our role
Yeah.
is to be able to field an exceptional clinical nursing team. um, that's what our goal is, and we're happy to do that.
Mhm. Absolutely. So, do you have any advice for other CNOs who might want to take a similar approach?
Do it now. Don't wait.
Mhm.
Ours was a fully electronic platform. So
Mhm.
prior to that, or the 6 hospitals we had that already had a ladder, we met with all of our facilities and created one for the whole company. So that was the launch in 2022, and we did it electronically. So no more binders and paper. The electronic version, much easier to launch and to maintain, because it's got to be evaluated every year annually that those nurses are still, engaging and performing, and whether
Mhm.
they're getting nationally board certified or they're a subject matter expert in pain management. There are a number of different ways that they can earn points within the ladder to
Mhm.
progress based on their experience. um, but that has to be all reviewed annually by those frontline teams at the
Mhm.
facilities. But I would say don't hesitate, get on it. We're happy. We've talked to a number of probably 25 different health systems who've said, hey, tell us a little bit about it. Help us get it kicked off, and we're happy to share that, because for me as a nurse for 32 years, best thing I can hope to do is the um, improve the environment for bedside nurses, because that directly improves the environment for our patients.
Mhm. Absolutely. Well, thank you so much, Trish, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And thank you so much to our audience for listening. Thank you, Trish.
Thank you, G. Hatfield. Nice to meet you.
You too. Thank you.